Welcome to The Buzz, where we bring you leaders in dental education discussing hot topic courses and industry trends. I'm Vanessa Emerson, founder of Dental Speakers Bureau, and today I'm interviewing Ryan Vett. Now, Ryan is a serial entrepreneur and a sought-after business consultant. And he's also married to a dentist and has served as VP of Marketing at NutriMedical. We are going to be speaking about his course entitled Embrace the Pain. So, Ryan, thanks for being here, first of all.
Thank you for having me.
Of course. And what is this about? Embrace the Pain. That leaves me it's one of those eyebrow raisers. So tell us what this course is about.
The reality is, well, I'm glad it's an eyebrow raiser. That's the point. But the reality is local anesthetic, that injection is feared by everybody. So many people think that the patients are afraid of it because it hurts and stings and all of that. The reality is practitioners don't like it either. First of all, nobody likes giving a shot. That's not something practitioners go home and say, I gave this many shots today, it was a good day. And it also slows them down. Anesthetic has been unreliable, it's unpredictable, it creates stigmas about dentists that they don't like, and it really impacts their entire schedule. And unreliable anesthetic throws them off. And so in this conversation, we really explore what it's like to change your local anesthetic practices to, first of all, make you more efficient, which is something that's not often associated with local anesthetic, as well as help overcome some of that patient stigma and eradicate patients' fear of going to the dentist altogether.
Wow. So that's pretty exciting. So that's a lot in there. Tell me a little more about how do patients engage with this course? What type of interaction, and like how do we ensure the return on investment for them?
So there's a couple main learning objectives. First of which is we go through the history of local anesthetic. So many people don't realize that the local anesthetic that's currently in their cartridge is actually originally a powder. And how did that powder come to be, and who discovered that, and how was it discovered? It's actually an interesting story. Who decided it should be in a 1.7 ml or 1.8 ml cartridge? And so we go through all the history, and then we look at how that history impacted the history of scheduling in dentistry. Because the reality is your entire schedule, from having your restorative column and then running over and doing hygiene and going back and forth, is all based on the inadequacies of local anesthetic. So how can you have a more efficient schedule? And then how can you overcome the patient's fear of going to the doctor or going to the dentist, which is often not associated with a cleaning, but associated with getting a shot if they need a procedure. And so we explore all of those different items in a lecture format so that people can go home with some tangible ways to improve their schedule, have new tools, resources, and techniques to help make the patient experience the most comfortable it can be when receiving an injection.
So thank you for that explanation. And so what I hear you saying is it's really some philosophy and some strategies to be able to help them be more productive and profitable, ultimately as a spin-off from that. But we're not really promoting a certain type of product as much as like sharing with them strategies that they can use in their office.
Correct.
Is there anything else that would be important for the meeting planner to know about this topic?
Absolutely. If you look at recent meetings, one of the most common sold out topics that you see at a lot of these national meetings are on local anesthetic, because it is a pain point for everybody. Nobody likes it. And so that's what we talk about in this conversation called Embrace the Pain, is how do you get past that pain point? And it delivers both a practice a growth strategy and a practice efficiency strategy, and how does that ultimately make you become more profitable? So we talk about all of that in this conversation so that it provides every attendee with a really good ROI. They can go home and do some tangible things to become more efficient and grow their practice with more comfortable local anesthesia.
Well, it sounds like a very interesting course, and it sounds like it would be very fun as well. I love the history angle. I think it helps people to understand where we've been, to understand where we can go. So thank you for sharing that with us today, Ryan, and congratulations on bringing something new and exciting to the market. I think that's also a real benefit for all of dentistry. So there you have it, our event planners that are listening in. For information on bringing Ryan Vett to speak for your next meeting, visit dentalspeakersbureau.com, and thanks again for tuning in.